What are the applications of AI in healthcare?
Things like booking an appointment for a patient, scheduling that, prescription writing, and then billing. All of these tasks are now being done by AI. AI to get into any domain requires digital data. Today, across the world, the most digital aspect of medicine is radiology.
So tell us more about how AI is functioning in radiology.
There are AI tools now that if you get a mammography scan done, will help the doctor find cancer even before the doctor can see it.
Today I have with me Mr. Vidur Mahajan, an unconventional doctor who chose to do an MBA later at the Wharton School of Business and is now leading the healthcare revolution in India with his own startup in AI called CARPL.ai. Welcome to the podcast, Vidur. We are super excited to be having you here. How's your experience at Masters Union?
Crazy, yeah? The first thing that struck was it's world class, right? Even when you're entering, नीचे से ही शुरू हो जाता है. So I am very jealous of the kids that are studying here.
Same here. I'm jealous too. I was like,
my undergrad was spent in a hospital in Bombay. So
we will come to that. In fact, that is my first question to you. If I look a professional in healthcare, you will do medicine, you will do your MD, you will become a doctor. But you've chosen a very different path where you've done your medicine studies, but then you've gone ahead and done your MBA at Wharton, and then you were running, Mahajan Imaging, which was more of a traditional business, if I could say that, and then now you're running your own startup. So would love to know how and when these transitions happened and what's the rationale behind the decisions that you took?
I think, very honestly, it's more to do with what feels like the best thing to do at that point in time in life. The going from medicine to management was probably the most unconventional decision I took. Now it's much more common. Like there are corporate hospitals, there's the consulting firms hire doctors, etc. So there's a much more defined path for doctor plus MBA. But I did it about almost 15 years ago. I was 22, 23 at the time, and I had come from Bombay where I was in medical school. I was at Sion Hospital there. So from there, I'd come to Delhi. I was studying for the PG entrance exams. Mm-hmm. And while I was doing that, I was just helping out my parents. So my parents ran what was a couple of imaging centers at that time. So I was just helping them out, brochure bana diye, website banwa di, kuch IT software I would just help them implement. So I always had a love affair with computers. Like growing up, I was like that person who would be trying to hack into people's computers and, do all of those coding bhi karta tha and all. I found it all very interesting, and slowly it became my aspiration to grow the family business. And this was all while I was pretending to study for the entrance exams, right?
For the postgrad.
Correct. Then it hit me that, if my true goal is to actually grow the business, then why should I be a tier 2 doctor? Because I would not be a tier 1 doctor, because my goal was not to be the greatest doctor on the planet. My goal was to scale up this business and probably the best business person out there.
Yeah.
And that's when I was getting a radiology postgrad. I cracked the exam, etc. So one day before the counseling, I went to my dad and I was like, Pa, I think I should manage radiologists rather than be a radiologist. So radiologists are a type of doctor that look at images and write reports and all that. He was like, do whatever you want. करना तुमने वही है जो चाहते हो, मतलब सुननी तो है नहीं. Because my dad, since I was in class 9, used to tell me, "Tu doctor nahi banega."
And your parents are doctors?
My dad is a doctor. My mom is on the administrative side. My dad was always like, "Ki yaar, medicine is a very hard life. You should do an MBA. Look at all these IIM people. They just chill all the time." So grass is always
greener on the other side.
But one thing led to another. I had that conversation with dad. He was like, do whatever you want. I went for the counseling next day. I left that radiology seat. That was personally a very big thing for me at that time. Then once I was in the administrative side of the world, I was building imaging centers, running imaging centers. I had the privilege of, exerting my authority without having to experience the downside. Right, so family business में ये बड़ा cool होता है कि you can enter as a बच्चा, everybody
and you
listens
have
to
the credibility and authority.
मतलब credibility तो चलो is vicarious, मतलब you may or may not have it, but you definitely have the authority. जो तुम बोलते हो वो typically हो जाता है, but if you fail, you have your parents to fall back on.
Yeah.
So that is an extreme kind of privilege that I had at that time, and I exercised it, opened new imaging centers, did a bunch of cool things, and then it struck me that the only PNL I had ever seen was my own. The only balance sheet I had ever seen was my own. I had not worked outside of the family business anywhere. So then I decided that it may be a cool thing to go and do an MBA. Was lucky, got into Wharton, had fun for 2 years because of a bunch of reasons. Decided to come back to India immediately after B school. Was running Mahajan Imaging again, this time with more confidence. And then this was 2016-17 when AI was just coming into medicine. And then I was always also, like I said, I loved computers. I was very much into neuroscience, and AI was an extension of that. So then I started building a research group at Mahajan Imaging, just out of passion, where we would work with companies all over the world that were building AI for doctors. So we would be their clinical partners. We formalized it into a separate department, and the moment we did that, it just exploded. Everybody from across the world was like, यार ये इंडिया में कुछ तो छोटा सा imaging center है, इनको if you reach out, they don't say no to work with. That happened. We started working with a bunch of AI companies. We realized that everybody was building AI, nobody was using it. Started making tools to make AI useful for doctors. And that's when CARPL came to be, and when we hit a little bit of scale at CARPL and conviction that it was going to be big. Then 2021 was when I left the family business. CARPL moved out into a separate venture. A bunch of us left with it. So it's actually the switching over from like the decision to not be a doctor was maybe the most unconventional. The rest kind of,
Is
just
transition, eventual
falls in place.
transition.
Yeah.
So right now, maybe you're not involved very much in the family business, but you're there for it, and then most of your time goes into CARPL.
110% of my time. See, we are venture backed, and we are growing on our growth trajectory. There's 58 people in the team now. I just counted literally yesterday. Our Slack, Slack, like that general group on Slack has 58 people. There are 10 people joining in the next 2 weeks. So it's pretty exciting.
Scaling fast.
Yeah. I'm probably going to ask you for some of the seats around here to make my people sit.
Of course. So let's understand a little bit more about AI and healthcare, right? So I think there has been a lot of talk about AI disrupting across industry, whether it's finance, whether it's education, whether it's healthcare. So talk us through what are the applications of AI in healthcare, and then talk about what you are doing with it.
Sure. You can break all of healthcare into 2 buckets. The first thing is there are administrative tasks and there are clinical tasks. Administrative tasks are things like booking an appointment for a patient, scheduling that patient into your list, right? There has to be a waiting list, right? You go, you see a doctor, there is a list of people the doctor has to see. Then there are things like on the administrative side, there's note taking, right?
Yeah.
Prescription writing, automatic prescriptions. Scribing is the new thing, right? Companies in the US growing exponentially, just putting a little microphone in the doctor's room, listening to everything, using Gen AI, etc., to automatically create prescriptions that are of nth level of detail. The doctor doesn't have to do anything. And then billing, right? Once you have been treated, you have to raise a bill to either the insurance company or to the patient or through the government. All of these tasks are now being done by AI. A lot of great companies in India also doing administrative AI. Like one of the leading companies in our domain on that side is a company called Ognito, which is a company that does voice to text. So if you're a doctor, you say a couple of lines, it'll make a full report out of it, right? So very, very powerful tools that are coming up on the administrative side. Opposite of that is clinical care, where you are basically treating the patient, right? Clinical care is like AI doing the work that a doctor does. You go to a doctor, you say, "Mere sar mein dard hai, peet mein dard hai." The doctor asks you 5 questions, writes a prescription. That is the clinical paradigm. AI is slower to enter there because it is higher implications.
High risk.
High risk, correct. By risk, I mean that the implications of the AI going wrong are really, really high, right? Like if you are operating at, say, most things in life work well at 99% accuracy. But if there are, 100,000 patients being seen in the city of Delhi by a certain type of doctor every day, and you have 99% accuracy, that means you are going wrong in 1,000 patients
Yeah.
every day, right? And Delhi में 1 लाख से बहुत ज़्यादा लोग हैं. So that is why AI is slower to come there, but you can again divide that into the patient's journey. Again, we look at it generally is there is the population health aspect of it, right? Where you are healthy, right? You don't have any issue, like possibly touch wood, me and you, right? We don't have any issue. हम यहाँ बैठे हैं मस्ती में बातें मार रहे हैं, but we are part of the healthy population. There's a lot of AI that is getting applied to figure out whether people like us will fall ill or not. If yes, what will we fall ill of? The whole world of genomics is there. There's mental health apps that you can put on your phone that will examine your speech pattern, that will examine how you're holding this phone and tell you, what's wrong with you.
So preventive care?
Preventive care and population measurement, right? But you are not yet sick.
Okay.
That's one domain of where AI is very useful. The second is where you now have a symptom, right? You have a pain in the head or you have a pain in the abdomen. That comes into the domain of diagnostics, right? Figuring out what is wrong. Diagnostics has two aspects. There is blood testing, pathology, and radiology. Radiology is MRI scans, CT scans, X-rays, ultrasounds, etc. A lot of AI is coming in here, and in fact, this is the fastest growing clinical AI specialty out there today, which is what also we are part of, right? After diagnostics comes therapeutics. Therapeutics is drug delivery, right? What medicine do I give? How do I make a new medicine? Even pharma companies that are making new medicines are using AI to figure out what medicine to make. The COVID vaccine, for example, much of it was created using AI, right? You can accelerate drug trials, etc. And then once you're treated by those, AI solutions, you go back to the population, right? Now you're again normal. Now you're again back into that paradigm. So that's broadly, these three buckets is how you can look at it.
And if I were to understand this well, what you are saying is as AI advances, we will first see the preventive care to come into the picture, right?
So I'll explain. AI to get into any domain, and we are talking about medicine right now, requires digital data. Today, across the world, the most digital aspect of medicine is radiology. Your MRI scans, CT scans, X-rays, ultrasounds, etc. are where all digital, it is all digitally native, right?
Yeah.
It's digital at the get-go. In population health, you still need to see a patient, you need to, look at a patient, you're not even a patient, right? You're doing a preventive health check. There's a lot of or a lot of analog aspects.
Correct.
Whereas radiology is totally digital.
So wherever there is digitization, it will
Correct.
be there.
Yes.
And if I were to just add, in case of preventive, right, with a lot of these healthcare devices
Yeah.
coming into picture,
Yes,
whether
they are
these
all digital.
They are all digital.
Correct. Ultrahuman is a great example of that, right? From
Yeah.
India for the world, it's incredible. They have digitized, so many things that we
Health
do.
parameters.
Correct. And, continuous glucose measurement, etc. But AI is only able to run on it. Or even get created for it because that data is digital.
So let's talk about your domain, which is radiology, right? Now you said radiology is digital from the beginning,
Correct.
right? So it's easier to apply AI there.
Yep.
So tell us more about how AI is functioning in radiology.
Sure. Hundreds of companies today that are building AI solutions to make radiologists, that are doctors that look at MRI, CT, X-ray, ultrasound, make them either faster or better.
Okay.
Right? And thereby eventually cheaper, right? You want to get one doctor to be as good as they can be for as many patients as they can be. And that is the broad premise of, or the broad promise of AI in the domain of radiology. In terms of applications, you can think of it in various domains. The easiest to think is if you follow the patient's journey again, right? There are radiology AI tools for preventive healthcare. For example, mammography, right? Every woman above the age of 40, anywhere on the planet, needs to get a mammogram done either once a year or once in 2 years in order to detect breast cancer earlier, right? I think it's widely now known that the earlier you detect breast cancer, the better the outcome for the woman. There are AI tools now that if you get a mammography scan done, will help the doctor find cancer even before the doctor can see it. These are like huge images, right?
Yeah.
Like megapixels upon megapixels of images where you're essentially looking in with a digital microscope and trying to find cancer.
Yeah.
People get exhausted. People may not be trained well enough. They might miss. And because there is so much people dependency, these scans are expensive. So AI comes in and says, okay, first and foremost, I will tell you, does this woman have cancer or not, right? So if AI says there is no cancer, you can, be relaxed कि अगर तुम्हें भी नहीं दिख रहा है,
So it's okay.
तो it's okay, right? मतलब you have a second pair of AI eyes, that is right, so you can go much faster, right? And your confidence increases.
Correct.
Trust me, it has a impact on doctors burning out also, because that stress of missing somebody's cancer, one, there is the ethical stress of it. Second, there's the legal stress of it. यार मिस कर दिया, जेल तो नहीं होगी, but कुछ तो होगा. That is one. Second is AI solutions. Once they have said cancer, no cancer, let's say they say cancer, yes, they will also tell you where they are seeing the cancer, right? That's also called explainable AI, right? Where the AI system will, on a mammogram, show, okay, will show a dabba or will show a heat map or will show some kind of output to say that, okay, this is where I have found the cancer. And then certain AI will go one level deeper to say, okay, this is the type of cancer that I have found. Another cool example I can share is of, say, stroke. Stroke is when blood to the brain either stops or there is a bleeding in the brain. It is widely said that time is brain in a stroke situation, because brain cells start dying, उन्हें blood नहीं मिल रहा, वो मर रहे हैं, and वो मर रहे हैं, and brain cells are the toughest to recover the function of, right? Earlier it was believed that they can't recover function. Now it is believed that they can recover, but it takes time, effort, a lot of stuff, right? And that with every passing minute, the probability of you recovering is falling. So होता क्या है? Patient comes into the emergency room, gets with suspected stroke, immediately they are taken for a CT scan. CT scan looks at their brain. Now you have to figure out कि one, उसको stroke है या नहीं है, and दो, उसको किस type का stroke है,
कहाँ पे है और किस
कहाँ पे है, किस type का है, right? किस type determines क्या treatment देना है. And the treatment for the two types of stroke that I told you, I said, एक में क्या होता है, blood रुक गया, दूसरे में bleed हो गया.
Yeah.
So they are the opposite of one another, right? One has too much blood,
The second
other
one
has no
is-
blood.
Yeah.
So the treatments are also opposite. So you can, if you give the wrong treatment, you can exacerbate the problem. So typically what would happen is, without AI, patient would come in, their CT scan would be done. CT, and these are typically in the middle of the night. CT scan goes to a radiologist. Radiologist already has 40-50 cases to report. तो वो 51st बन के आ जाता है, right? If somebody calls up and says, डॉक्टर साहब पहले देख लो, तो मे बी वो 51st से 16th हो जाएगा, and thereby valuable time was being lost, and like a lot of coordination effort. You then have to call the neurologist who has to come and treat the patient,
Yeah.
right? You don't want to activate everybody because it's a waste.
Yeah.
Now with AI, what's happening is patient comes into the ER, into the emergency room, suspected stroke, goes into the CT scanner. CT scanner say the images go to AI. AI figures out, is there stroke, where is the stroke, and what is the type. And then the AI model itself at that time triggers the radiologist to say, read this scan first, leave everything you are doing, read this scan
This
first.
is the most important.
This is the most important scan in our system today. And the AI model also, when the radiologist is looking at those images, assists them in saying, अच्छा यहाँ पे देखो जी, यहाँ पे है.
हाँ, आधा काम तो कर ही दिया.
Correct. So the radiologist life is very easy for them. They have the output, they have the raw data. They say, okay, I agree, and everything is triggered, and thereby, like but even a saving of 20-30 minutes in such a scenario is the difference between a person getting physiotherapy for 1 year versus 1 month. right? In
Or
order
life
to
and
recover.
death, right?
Or like, of course. I don't want to make it very morbid, but yeah. So that's the value that AI is bringing, right? All the way from preventive health check, mammograms, cardiac disease. ये वो मतलब we literally look at the ecosystem as body part times disease, right? For every body part there are certain diseases. उतना AI का impact हो सकता है, which is basically a textbook of medicine, and you go through the index page.
Yeah.
So that's what is happening here.
Wow. And given that, till date, developed nations like US, China have been ahead in the game of AI, my assumption was that most of these technologies would already be existing in US. So we want to understand specifically what your company does and how is it different from what exists already.
So I'll correct you first. I would say like developing world, if we had to bucket like all of us into that, is maybe far ahead of the developed world in terms of AI adoption, because of one of the major uses of AI being screening for disease, especially infectious disease, more specifically tuberculosis. In India, there are X-ray machines that are going from gaon to gaon using AI to screen patients for tuberculosis without any human intervention at all. So this was approved by the WHO a couple of years ago, and governments have worked at warp speed. Already it is a target of India to eradicate TB by 2030. So towards that end, there's a lot of screening, a lot of stuff that happens in the developed world using AI. It's just it becomes so routine, right, that you're talking about it. मतलब who wants to know यार TB screening हो रही है गांव में जब शुरू हुई थी
everybody talked about it,
right. So that is one, like I just wanted to kind of address that. As far as what we do, we are actually addressing the adoption problem. So the very problem that you mentioned is there's a lot of AI being built out there, right? I mentioned like so many companies building these tools, so many FDA approvals, etc. Hardly any clinical adoption, right? If you go to any hospital anywhere in the world and you ask them, आप कितना AI use कर रहे हैं, they will typically give you an answer that's either 0 or low single digits.
Yeah.
Right? So why is that? Well, the problem is there are just so many AI solutions out there that healthcare providers just find it impossible to bring them into their workflows.
Don't know what to use, how to use.
Exactly, don't know what to use, don't know where to start. यार, what to use तो बहुत आगे की बात है. Don't know where to start, don't know what's out there, don't know whether it will work or not. AI has this problem where it can be very good for your hospital, not as good for my hospital, because you have one type of machine, I have another type of machine, and it was trained on your type of data. So that is one, it's called the problem of generalizability of AI. So that exists. So that's the problem we are solving here at CARPL. We are the inferencing layer. So in AI, मतलब AI को चलाने को fancy words में inferencing बोलते हैं. So we are the enablement layer for AI at hospitals. We have partnerships with 66 different AI companies globally that provide 154 solutions on our platform, using which the world's top radiology groups, radiology departments, can test these solutions, figure out whether they even work or not for their patients.
For their machines also.
For
right?
their machines, for their patients. So using our platform, healthcare providers can figure out whether AI even works for them or not. So we are basically the Amazon of radiology AI in a way, where you can figure out what you want to buy, you can try before you buy, and then you can actually buy and implement it in your
But with
workflows.
a lot of customized support, because this is technical, right? So
Yeah.
they
So
may need
we
implementation.
productized it all. There's not a lot of people that are doing things like it's a bunch of connectors, adapters, etc. But broadly speaking, yes.
So, I mean, this is the first thing that you've done, and I'm sure you have very ambitious plans of what AI can do next for CARPL.
Yeah.
So, I want to understand a little bit more about where do you see CARPL going from here, in what kind of applications of AI, and do you want to go beyond radiology?
Yeah. Radiology, as I mentioned at the start, right? Radiology is the starting point because it is digital, and because it's digital, there's a lot of AI for it. There's a big need for it also. right? There are not enough radiologists. Like the industry is growing at 12%, doctors are growing at 2%, right? So there's a disconnect. We are starting with radiology. We're already moving into adjacent fields of diagnostics like digital pathology, genomics, ophthalmology, dermatology, all the areas where there's an element of diagnostics. And as more and more AI models get built for clinical medicine, gastroenterology, rheumatology, oncology, etc., we'll get into all of those ologies. and the holy grail is, of course, automated robotic surgery, right? Where
Yeah, so basically detection is to the machines and then
everything, whether you
treatment is to the
I don't know what
machines.
will happen. It's
To the doctors?
I wish. No, it's about there are not enough doctors on the planet, right?
Fair.
Like
So we need that help.
That said, one thing I'd like, especially you mentioned a lot of youngsters will be listening to this. One should also not get too enamored by this stuff, right? Because I am giving you all this gyan, right, and all of these ologies, but we live in a country where people die of hunger, yaar.
Yeah.
Like it is crazy to
Yes.
think of. People die of diarrhea. You are not supposed to die of diarrhea anymore in this
World.
right?
Yeah,
You're not supposed to die of malaria
or dengue.
or dengue, whatever, right? But
Yeah.
so one must not lose sight of reality as we go ahead and
Implement
do
all
all
of this,
all of these
yeah.
things, and as people think of their careers and stuff.
Thank you, Vidur. I think we all got a lot of gyan, as you said, about AI and healthcare, and it is so exciting to see that within 10 years, I think we can be in that imaginary world which you said, where the AI is diagnosing it.
Correct.
And then potentially, if it is able to figure out what it is, and you have a robot who can do the surgery and the treatment as well, you're just being treated and diagnosed by machines.
Yeah, correct. And
Yeah.
hopefully people will not be dying of hunger.
Fair enough. Thank you so much,
Thank
Vidur.
you. Thanks, Swati. It's an
Loved
honor.
interacting with
Thank you
you.
for having me.